rabies, where maximizing impact, overcoming resource wastage in mass dog vaccination. So this is a very important topic for the world, for the elimination of canine rabies, because as we all know, resources are very limited. And when we don't have enough resources, we need to prioritize and also use the best tools to perform dog mass vaccination against rabies. So today, we will share with you a lot of experiences around the world and also coordination of activity that has been performed. Just to give you an example, in Latin America, we vaccinate about 100 million dogs every year by the public health. And of course, much more dogs must be reached to vaccinate against rabies. So today we will have this opportunity to understand what's happening in other parts of the world and also discuss important topics as availability of vaccine, the importance of good quality vaccine, and the importance of dog population estimation. There is a crucial information regarding dog mass vaccination planning. So today we will have a presentation panelist that will be in charge, Dr. Cassandra Botel. She's from the US CDC, and Dr. Cassandra will introduce us with this topic. Just a quick reminder that we have all the chat and questions and answers options, so you can introduce yourself using the chat. And also, please, all your questions you can write down, and then we will be ready to answer you. So, Cassandra, thank you very much again for your presence here. And please, go ahead. Thank you.
Thank you. I'm going to head and share my screen. All right. Thank you for the introduction, Marco. And today I'm going to be starting us off with talking about our new STARK methodology that we've developed here at US CDC and how we use that to define urbanicity, map rabies risk, and estimate dog populations. So, STARK stands for Settlement Type and Road Connectivity, and we developed this methodology because, as we all know, rabies does not respect political boundaries. While we may use political boundaries to plan our vaccination campaigns or other control strategies, the actual disease, the actual dogs, they don't care about those imaginary lines. So we wanted a methodology to help combat that gap. Some of the rationale for having STARK is to help ensure that contiguous populations of dogs are vaccinated during vaccination campaigns, helping to assist with prioritization of resources when those resources are limited. It can also be used to help evaluate the continuity of your vaccination coverages, making sure that there are no pockets of low coverage in your vaccination area. And it's also useful for visualizing surveillance data and estimating dog populations either overall or at a smaller scale within a country. As I mentioned, STARK stands for Settlement Type and Road Connectivity, and these two ideas are really the core concepts of STARK. Settlement type is the number of people that live in an area. So whether that's highly urban and built up areas with a lot of people in one spot, or all the way down to more rural areas with just a few people per square kilometer. And then road connectivity is how well connected a place is, how many people travel to and from there, and how easy it is to get to a place. So whether they have primary highways that are paved and a lot of people travel on them, or just smaller dirt roads that really just connect villages and they don't see a lot of traffic. We then combine these two ideas to determine the urbanicity of an area and create a Stark code. So what's done is a grid of 1 square kilometer hexagons is overlaid across the country, and every single one of those grid spaces is assigned a road type and a population density. These are based off of open source information from OpenStreetMap, is how we determine what type of roads run through an area. And we use data from Meta to determine how many people are in an area. And these two combined create a Stark code. There's a total combination of 24 possible Stark codes, and that gives us an idea of what the urbanicity of an area is at a very small scale. Once we have Stark codes assigned across the entire country, we're able to use that to help estimate dog populations. Stark takes inputs of human to dog ratios that are user defined for each and every single Stark code. So a user can specify the human to dog ratio for each Stark code to make sure that each type of urbanicity gets its specific human to dog ratio that's necessary to help estimate the dog population across the country. So once we use human to dog ratios to calculate the number of dogs in every area across the country, we use a statistical test called the GETIS or GI test to identify hotspots in dog populations. These are areas where there's a significantly high number of dogs and where we expect to see rabies transmission really occurring and thriving. From those hotspots, we expand those outwards into what we call clusters. So here you can see in this map, this red spot is the hotspot and the blue is what we call a cluster. And those clusters are areas that are close enough to the hotspots based off of the average range of a free roaming dog. Those areas that are close enough to the hotspots that have enough dogs and the sufficient road connectivity that we think that rabies transmission would still occur there. We take this even one step farther into creating what we call zones that we classify into 2 different categories. Transmission zones are those groupings of clusters that are close together and they are likely to support sustained rabies transmission. So they have a high enough density of dogs and a high enough number of dogs that we expect that rabies in any part of that zone, if it exists, could spread across the entirety of the zone. Susceptible zones, on the other hand, are those groupings of clusters where we may see rabies outbreaks, but we don't expect that sustained rabies transmission would occur there without continuous reintroduction of the disease. And how is Stark helpful in planning your vaccination campaigns? We're going to take a little look at an example from Chad of a vaccination campaign that occurred over 3 years, back in 2012 to 2014, and they achieved a high coverage of vaccination in the city that they were working in. But after less than a year, cases returned to the city. If we take a look at this through the eyes of Stark, it's fairly easy to see why. You can see here, this black boundary is the city boundaries that they used for the vaccination campaign planning. And everything within that is the city boundaries, but the Stark cluster expands all the way out to this blue line. So we expect that rabies existing in any part of this zone would spread across the entire zone. And so even though they achieved sufficient vaccination coverage within the city, all of these dogs out here are contributing to transmission. And so they did not achieve sufficient coverage outside of the city, which meant they had reoccurring cases. Even taking a look at zoomed in satellite images of this city, you can see that there's really no significant change of the human population within the city and outside of the city boundaries. You can see it's pretty continuous and there's really no significant difference. So why would we plan based off of this arbitrary line here? Even international boundaries, there's continuous human populations on both sides of Chad and Cameroon in this area, where rabies transmission could occur across this boundary. STARK can also be used to help supplement some other tools that we've developed for vaccination planning. We have Rabies Econ, which helps to estimate the rabies burden across the country. GDREP, or the Global Dog Rabies Elimination Pathway, which helps you understand the long-term cost effectiveness of all of your control program. And VaxPlan, which helps in planning with calculating campaign costs and comparing different vaccination strategies for your campaign. All of these have been previously published, and all of these can use some of the results from the STARK analysis as their inputs and help you get better estimates from these tools. We've already mapped quite a lot of the world, and the aim with this is to help get more accurate burden estimates of how many deaths and exactly where that burden is. So a lot of times you will see maps at a country scale where an entire country is red if they have canine rabies endemic. But you can see that actually that's not where people are and that's not where dogs are. There's really just a small section of places where people actually are and where the rabies burden is actually occurring. So this helps give a better idea of really where the burden is, not just across an entire country. Through this entire process, we've had to do a lot of searching for human to dog ratios to use as inputs for STARK. And with that, we have created a human to dog ratio repository that's now available on the UAR website in the toolbox. And this is a repository of all of the published literature that we've gathered through our process of running STARK for several countries. It contains country name as well as what level that study was conducted on, whether it was just one city or across the country, the specific name of where the study was conducted, as well as the urbanicity of the areas that they looked at, and of course, the human dog ratio estimate that they resulted with, and this actual link to the study. Right now, it contains estimates from about 30 canine endemic countries. However, we are currently reviewing over 4,000 publications to complete a scoping review. So we hope that this list grows and we hope to maintain it and keep it updated with any new publications that come along. Also within this repository, there are specific sheets of those countries we have already run through STARK, and they do have the free roaming dog population estimates that STARK has calculated for those countries. That information is on a different sheet, and it will let you know if it uses inputs from a published study or regional estimates or census estimates, and all that information is on other sheets within the repository. If you have any questions or any requests for STARK or any of the other tools I mentioned, please feel free to email rabies@cdc.gov. But thank you all for listening.
Cassandra, thank you very much for your excellent presentation. Now I will introduce you all the other members of the panel, so please ask you to turn on your camera. Dr. Gregorio Torres, he is the head of the Science Department of the World Organization for Animal Health from OHA. Thank you, Dr. Gregorio, to be here with us. Dr. Yukio is an animal health officer at the Animal Production and Health Division of Food and Agriculture Organization of the United Nations from FAO. Thank you, the Dr. Q, to be with us. And Dr. Glory Yale, she's a rabies program and technical manager of the Veterinary Public Health Division of Seva Santé Animal, focusing on field program implementation and management of our rabies vaccination. So thank you very much for your presence here. It's very important, this discussion that Cassandra brought to us for this roundtable. Cassandra, so according with your studies you presented, so that famous ratio 1 to 10, so 1 dog to 10 people does not exist anymore. So this is very important to perform the estimation at the local level. We have also these examples in several countries in Latin America. The ratio may vary from 1 to 2, so 1 dog to 2 people, through 1 to 7, but we don't have any place anymore of the old famous 1 to 10. So Cassandra, I would like to make you the first question to introduce this discussion, and please feel free, all other members of the panel can raise your hand and also contribute with your thoughts, with your experience as well. So Cassandra, how important is to know the dog population before you start a dog mass vaccination campaign?
Yeah, so well, it is important to know your dog population so you have an idea of how much vaccine you need and how many vaccinators you need. That really should not be something stopping you from starting vaccination campaigns. Throughout the vaccination campaign process, if you're doing it right, you're doing a post-vaccination survey, and that will help you get a better estimate and a better idea of the number of dogs that you have in that area. So while you do need a rough estimate just to know the number of vaccines, it really shouldn't stop you, and you'll get a better estimate through the vaccination campaign process.
But just complementing these thoughts, so how do you think, how accurate should be this data that should be produced by these estimations?
So for post-vaccination campaigns or for pre when you're using Stark or something else?
The campaign. So how accurate should be this data that you are suggesting us to implement this estimation of the population? Do you think it should be accurate, or should I estimate it using any method, or?
For inputs for Stark, we have actually found that some census estimates are really not that great to use as inputs for Stark. We have run Stark for a few of the vaccination campaigns that we've helped plan, and using census estimates, the dog populations are actually way off compared to what they found in their post-vaccination surveys. But before the campaign started, we used regional estimates and used expert knowledge to come up with different estimates from their census. And those estimates were actually fairly accurate with their post-vaccination surveys. So using regional estimates, using expert knowledge, that is really sufficient to get a good enough idea to start your campaign.
Thank you, Dr. Cassandra. So, Dr. Gregorio, please, we all know that WOHA has a vaccine bank for canine rabies. So, can you tell us, how the countries could access these vaccines, and what do you think about the quality of the dog rabies vaccine that should be used by the countries as well? Thank you.
Thanks, Marco, and thanks, United Against Rabies, for bringing us together in the webinar. I think this topic is extremely important because it's not only how to vaccinate dogs, we need to vaccinate the right dogs at the right time with the right methodology. And congratulations, Cassandra and the team, because the tool you presented today, I think it's going to help us to really gain efficiency in the way we've been operating. We acknowledge we've been trying to maintain this message of the 70% vaccination campaign or vaccination coverage across the country, and we know how difficult it is. We do need to bring this this efficiency in the vaccination campaign, and the tools you presented today and I know you've been using in several countries are extremely useful. So I congratulate and I invite everybody to use it. But Marco, going back to your question, all the vaccination campaigns are extremely expensive operation. Anything will not make any sense if we are not using high quality vaccine. And we have seen, unfortunately, we have seen so many times where the planning is perfect, the data are perfect, the vaccinators are well trained, everything is perfect, except the actual biological, which is actually probably the cheapest in the whole vaccination operation. So starting with a high quality vaccine, I think it's basic, it's a basic principle, but we have seen many times failing. And when we fail because we are using a poor quality vaccine, basically we are losing the race against rabies. We are losing the trust of the decision makers, the trust of the donors, and even the frustration in the population and the trust of the people that suffer rabies on a regular basis. For that reason, the WOA, almost 10 years ago now, we create this the vaccine bank, what we call vaccine bank. So far, we deliver around 30 million doses of vaccines in different countries. The objective is definitely not to replace the procurement system at the country, but to try to help the countries to focus on what's matter, which is the strategic design of the vaccination campaign, as Cassandra just mentioned. So it's a way of incentivizing and helping the countries to overcome this critical barrier, which is having access to high quality vaccines. The vaccine bank, which we've been communicating for more than 10 years, so most of you have used it or have been here. I must clarify something. The vaccines are not free. Somebody pay for it. And we say, oh, it's a free vaccine. No, that's not true. Somebody pay for it. And there is three mechanisms, three options to get access to this high quality vaccine. One is that there is a donation. There is a donor, an investor that we call it, that is willing to help countries that are having difficulties with rabies, and they provide this vaccine free of charge, but they pay for it. So they pay for the vaccine, and the countries can request having access to the WOA vaccine bank and can get this vaccine at no cost. The second option is direct purchase. So the countries can request access to the vaccine bank and be ready to pay for the vaccine themselves. And that could be also an option. So the benefit is that they will have access to high quality vaccine and also a probably competitive price, because the economic of scale, as you know, the vaccine bank, the provider has been selected according to an international tender. So because we buy a big amount of vaccine, so the vaccine is in a preferable price, let's say. So either donation, direct purchase, but we can also have a third party. Let's say there is a NGO, let's say there is a university, there is somebody wanted to pay on behalf of the country. That could also have a possibility. So these three options end exactly the same place, which is having high quality vaccines at the door of the country. So how it works? Well, the first thing is to get a plan. You know, countries need to have a little plan on how these vaccines are going to be used. So there is a specific form that the countries need to complete. It's very basic. Don't need to be very, very complicated, but at least need to explain how the vaccine are going to be used and by when and what is the strategy. Then there's a request, official request to the WOA Director General. So it's the delegate, WOA, normally it's the Chief Veterinary Officer, should write a letter to WOA saying if they can have access to the vaccine bank according to these three options I just mentioned, with this information. And one has been agreed and the vaccine is available, you know, WOA system, which my colleague Natalie, who is managing the vaccine bank, she's unfortunately traveling and not being available. She will arrange the transport with the vaccine manufacturer, and WOA responsibility is to bring the vaccine to the country. And then once in the country, is the country responsibility to take care of the cold chain and distribution. But at least the amount of vaccine requested will arrive at the country to help the countries to progress on rabies elimination. And probably the last point, Marco, if I might, this is not the end. We are requesting, once the vaccination campaign has been finalized, we request a short report explaining how this vaccine has been used. So all in all, it's again, repeating, it's a mechanism to help countries to focus in the strategic vaccination while ensuring that the high quality vaccine are being used in this vaccination campaign. There is plenty of information around the WA Vaccine Bank in the website. We have a very extensive frequent asked questions, so you can just Google or get into the website so you get a little bit more details. And of course, myself and the team will remain totally available to respond to those questions. But the bottom line is that we should not use low quality vaccine, and access to high quality vaccine is possible by many different means, including the WA Vaccine Bank. So that's for me on a very brief, and I'm happy to expand if you need me to do so. Thanks, Marco.
No, fantastic, Gregorio. Thank you very much for your explanation regarding how the WOHA Vaccine Bank works, because this is a great opportunity for countries, for other organizations or institutions have to use to procure. No, as you know, in Americas region, we have also the revolving fund only for the countries in Americas that has been using the revolving fund of human vaccine, and also are included the canine rabies vaccine. So the countries are procuring every year about 30 or 40 million doses. So that contribute to the dog mass vaccination in the continent. So hopefully other continents and other organizations could also support the countries in this difficult task, that is to have good quality, safe vaccine available for the dog mass vaccination. So in this question, so I'd like to ask the Dr. Yukio. Thank you, Dr. Yukio, for being here. And how FAO is supporting the countries to use safe, efficacious, and high-quality dog vaccines for using those campaigns that you are talking about?
Thank you very much, Michael. And hello, everyone. I'm very happy to see you here and to discuss with all of you on this very important topic. And we have just heard from the earlier discussion, and also very much appreciate Gregorio from WOHA to share the information, especially stress the importance of using high quality vaccine, and also the mechanism utilized by WOHA as a vaccine bank. So here I would also very much like to share the perspective from FAO and our highlighted activities on the importance of vaccine, quality vaccine. So FAO is actively supporting countries on rabies control, including the procurement of safe, effective, and high-quality rabies vaccine to support the mass dog vaccination campaigns in the field. And this is achieved through three primary approaches. The first one is FAO does careful technical clearance during the vaccine procurement process. So when FAO procures vaccine to support its member countries upon request and based on their project budget, we make careful assessment to ensure that all the vaccines procured by FAO should meet the international standards before the procurement. And also over the years, we have observed that some rabies vaccines, despite being licensed and marketed, they actually lack the necessary documentation to confirm their compliance with the international standards, or they do not fully meet the international standards themselves. And the FAO technical assessment and clearance step during the procurement stage will help FAO to rule out the unqualified vaccine and ensure that only safe and effective vaccines are delivered to support FAO member countries on the dog vaccination campaign in the field. And secondly, FAO is now in the process to establish a vaccine registration system. So FAO frequently needs to buy vaccine during the emergency situation to help member countries to tackle and control the emergency outbreaks in the field. To better support the rapid vaccine procurement, FAO is now in the process to establish a vaccine registration system. So this system will only register veterinary vaccines including rabies vaccines that meet international standards. By doing so, it will facilitate the rapid procurement during emergency situations, as the registered vaccine will no longer require additional technical clearance. This will facilitate their use and procurement during the urgent scenarios. Thirdly, FAO is also providing technical support to vaccine manufacturers. So during the public-private partnership platform, FAO provides technical support and guidance to vaccine manufacturers with potential to improve their products. For example, like in September this year, FAO has organized its first ever global conference on animal health innovation, reference centers, and vaccines. And during this conference, we organized some side events, closely engaged some vaccine manufacturers in the discussion on how to supply and how to use the good quality vaccines on important animal disease. So when FAO is supporting vaccine manufacturers, this is being done through providing comments, feedbacks, and also the on-site visit to the vaccine manufacturers to help them get a good knowledge about the current gaps and also areas for improvement to better align the vaccine products with the international standard, and therefore to increase the availability of high-quality vaccines in the market. Through those efforts, FAO aims to improve its member countries' access to high-quality vaccines and ensure the success of mass dog vaccination campaigns in the field. And so far, I would like to highlight that FAO has only been procuring the traditional injectable rabies vaccine for dogs. But now we are already at the stage to consider the oral rabies vaccine. Possibly in the near future, we will develop some technical specifications that help the FAO country teams and also the member countries to procure and use oral rabies vaccine. Thank you. Back to you, Marco.
Thank you very much, Dr. You know that FAO has always been supporting our countries, as United Nations System Specialized Agency, for also supporting animal health activities, and this is very important. These jointly efforts of several organizations and institutions to eliminate, the canine rabies. That is our goal for 2030. So, Dr. Gori, please, could explain to us or could tell us some of your experience how important is to demonstrate that the dog mass vaccination has been really effective. So what do you think about it? So we should demonstrate, is that important? Thank you, Gori.
Thank you, Marco. This is one of my favorite questions. A lot of governments, municipalities are interested in controlling rabies and they start a program, but a lot of effort and resources is directed towards assessing if the vaccination campaign was successful. And the methods used are not great always. Like you and Gregorio mentioned that using a quality vaccine is very important. And there are enough information out there for people to select a good vaccine. So if you've chosen a good vaccine, you don't have to go and check if the vaccine works. You trust that the vaccine works. There are several ways of assessing the vaccination campaign coverage. You could do a post-vaccination survey by doing a verbal survey, talking to people. If you've marked a dog during vaccination, you can count the dogs that you've been able to vaccinate. If you're given vaccination cards, that is another way. But it is really hard to assess how many of the dogs that don't have owners. And if you're using ORV, oral rabies vaccine, you can't mark these dogs. So the best way is to use a good vaccine and have a good surveillance team in place, including IBCM, where you actually see the number of cases go down over the years. If rabies in your area, in your project is reducing, it's obvious that the vaccine works and this project is successful. Do it for a few years and then assess it. A very common question I've been asked is if serology is a good tool to assess. And academically, serology is very interesting. Or if you're seeing the response of a dog towards a vaccine individually, suppose you're transporting the dog across a country, then serology is important. But to assess a campaign, no way. One thing everyone has to remember, there is no assay that can mimic the body 100%. So when an animal or a person takes a vaccine, there are several factors that are attacking the virus to kill it. So suppose there are around 10 things that are neutralizing or killing the virus. The assay can mimic maybe 2 or 3 things. So if your assay can show that there is an antibody response, it is not telling you all the information. It's just telling you maybe 30–40% of the information that is really happening in a dog's body. So my advice is look for challenge study data, because vaccine companies have already done this. They're proving that their vaccine works by actually challenging the dog with a real virus. So trust this data, trust your regulatory authorities, and use a good vaccine and watch rabies go down.
Thank you very much, Rory. So I was also thinking here, so if we have good quality vaccine that is already proven, has a national control of quality. For example, many countries, to release a batch of dog rabies vaccine, they need to test this vaccine and see if all the requirements are okay. So then release it to commercial level or to the governmental level. So we know that, for example, some countries, I would say here, I don't know, Brazil, Argentina, the countries from our region, they do that. So every rabies vaccine available for both public dog mass vaccination campaign and for the veterinary has been tested. And we know that they're good and high quality vaccines. So having this, have an estimation accurate, as Cassandra already mentions us. So we need to have all the information, or at least the maximum information available to vaccinate dogs. And also, as Dr. Yu said, so if you have this system of registration and supporting all the legislation in the country, so if you have all these conditions, expand resources for doing a serology would only confirm what we knew already. So if I do have let's say a dog mass vaccination campaign that reaches 80% or 70% of the population that I estimate, I use quality. If I do a check, let's say with the serology, I'm going to spend resources. No, so the resources, they should be converted to buy, I don't know, human rabies vaccine, for example, or more dog rabies vaccine, or to reach that population that I saw some comments here in the chat regarding oral dog vaccination. So for those dogs that I can't reach in the parenteral vaccination. So what do you think about it, Cassandra, this changing of paradigm that we need to check with the serology? Because in human health, for example, for measles vaccination or for polio vaccination, I don't do serology of people to check if they're. So if I have a good dog mass vaccination campaign planned, I have the estimation of population, and I could evaluate after the vaccination. So use the serology would only spend more resources than I have. I don't know, Cassandra, what do you think about? And then I want to know what Gregorio thinks about as well. Please, Cassandra.
I definitely agree with everything both you and Gowrie have said, that if you're using that quality vaccine and you're checking that you've covered the right coverage of dogs and you're seeing rabies actually decrease, there's really no need to expend the resources on serology.
So Gregorio, what do you think?
Well, Marco, I think you can anticipate my answer as well. No, money needs to go to dogs. So basically, at some point, somebody say rabies elimination, it's simple. You just need to get the vaccine inside the dog. And that's it. Inside the right dog. That's it. No need. If you got any resources, just put it in more dogs vaccination. Of course, communication, of course, post-exposure prophylaxis for humans. But I think to be very clear, and this is what we are trying to align also with WHO recommendation, is there is no need to do serology. What we need to do is to make sure that the dogs has been vaccinated. And there is many techniques. You just mark and then go back to make sure that there is sufficient number of dogs has been vaccinated. But catching the dogs, taking a blood sample, sending that to the lab, it's not going to bring any advantage at all. And what we are doing here is public health intervention. We are vaccinating our dogs to protect humans. And the only way to do it efficiently is to select the right population, as Cassandra explained, the vaccine, and use high quality vaccine that has been manufactured according to the international standard. The rest, it's a little bit of the wasting of money, if I can be a little bit provocative with my intervention.
No, I think, it's very important. All the provocative is important, so make us think about it. And this breaking the paradigms that we think about, that we need to feel about.
Probably,
So,
Marco, if I may make an intervention, which I understand the confusion here, because for other disease, we do request, because they are not as lucky as we are. We do have a high quality vaccine, but for other animal disease like foot and mouth disease, PPR, avian influenza, we do say you need to do serology. So I do see the confusion for some countries. But now we are dealing with rabies. What we got a high quality vaccine. If you put this vaccine in the dog is going to be protected at population level. And this is what we need. So it's not a straightforward interpolation of what's happening with other disease and rabies. Rabies is very particular for the good and the bad things, but in rabies, we don't need to spend money in doing something which is not necessary. Unfortunately, our resources are very limited and need to be very well looked after.
Dr. Yu, please go ahead. I was going to open you the microphone. So please, what are your thoughts about it?
Yes, thank you very much, Michael. And also, I fully agree with the earlier comments made by you all. And I just wanted to share that from FAO side, on vaccine-related work, our biggest budget go to the vaccine procurement, but we are also trying very hard to also allocate some resources and budget to support the post-vaccination monitoring. Because for sure, the vaccine quality is one of the most important factors, but we also need to monitor all the steps, like just explained. There are many other steps in the last mile that we need to make sure that they all go properly and the animals, they have already reached the desired immunity level. And by doing that, we always advocate and also support our member countries on the stress and the surveillance, often through the stress and the passive surveillance on the disease monitoring. But on rabies, we are fully aligned with the recommendation from WHA and WHO, and for the serological testing after the vaccination has not been advocated. So.
Thank you very much. Gauri, so what do you think also regarding this expanding of resources and other place that we should apply these resources that we are not going to use to do this serology? Where should we also apply in a dog mass vaccination campaign? Because we know you have a lot of experience in the field, as in India, so please go ahead. Share with us your experience.
You have maxed out 80% of your dog population and free roaming dog population. So the target population that's transmitting rabies, and you're still left over with some money, I would say use it for communication. Bring awareness in people to vaccinate their dogs, and also to vaccinate themselves if they're bitten. But because people are primary a skeleton of the program. If people don't cooperate, then a program won't be successful.
Thank you, thank you. So we have several questions from the audience in the Q&A box. So here I have
Marco.
Yes,
Marco. I had a question for our panelists. One to Gregorio and one to Cassandra, if you don't mind.
Please go ahead.
Gregorio, what is the time frame that is required for to deliver the vaccine from the vaccine bank? Approximate time period.
Very, very good question, Gauri. I should have probably said in the introduction. It's relatively short. There is different time frame that we work. We can deliver with just a few weeks, but the price is a bit more expensive. So what we anticipate, what we ask our countries is to plan ahead and give us a couple of months, and that should be sufficient to receive a good quality vaccine at the time you need to vaccination campaign. So for emergency situation, we can shorten the whole time frame, but that is an implication of cost as well. So what we are expecting is at least to receive this request at least 2 months before the actual vaccination campaign, to give us enough time to deliver without any problems, which, by the way, is actually what you need to have a good plan. So a good vaccination campaign needs to be planned. And one of the plan is forecast the number of vaccines you need. So we are kind of working with this time frame. Thanks, Wari, for that question, which is very good.
Because usually World Rabies Day, people in September go, oh, we should just ask for vaccine. You need at least 2 months. So think about it in July if you want the vaccine for World Rabies Day. Thank you, Gregorio. And Cassandra, my question was, I love the Stark analysis. It really helps governments plan their vaccination programs. But not everyone's equipped to do this themselves. They might have the input data, but they don't have the technical expertise to put this together. Is there a way that people can reach you, and is it okay for anyone to reach you?
Yeah, so I will say that Stark, the publication is currently under review, and I believe it's already been answered in a couple of questions, but there is a GitHub link with all of the R code that we use to run these analyses. So if you are equipped to do that yourself, you can have access to the code there, and very soon the full methods in a publication. But for those who may not be equipped to do analyses themselves, definitely you are able to email us at rabies@cdc.gov with any request for a Stark analysis. We have been putting together pretty standard, we call them geospatial risk assessments, that includes a Stark analysis, as well as some of the other tools that I highlighted, including Rabies Econ and GDREF, using estimates that HDR estimates that maybe the country that asked for it provided, or we'll find it from the literature. And we're able to get back to you with the outputs of that analysis. And yeah, anyone can reach out and we'll answer those as we have capacity, but we do hope to get these out to more people so that they can start using them.
Yeah, thank you, Cassandra. Over to you, Marco.
No, thank you very much, Lauren. So please, if you have other questions among us, please go ahead to answer. But I have one question here that is in the box. So this is for everyone, including myself, I think, but I will answer at the last one because you know we want to hear all your opinions. But with limited financial and human resources of a government or organization, does it make sense to carry out both population vaccination and population management in the form of spay and neuter campaigns, or should they focus only on vaccination? So who wants to be the first?
Yeah, I'll go ahead.
See, go ahead.
Please don't waste your money on animal birth control surgeries. It's a limited pot. Money doesn't grow on trees. And if you're aiming to control rabies, vaccinate your dogs. ABC, animal birth control surgeries, is a complementary tool program for rabies control, but it's not any of the primary strategies you should use.
Thank you. Or anyone else would like to?
Yeah, I totally agree with Wari. And here we are talking about maximizing the resources, and the best way to tackle rabies is by vaccinating dogs. I'm going to keep insisting on that. So using other strategies are complementary. There is always a reason to do this spay neutralization by, it could be responsible dog ownership. There is reason to do that. But if we really want to break the cycle of transmission, if we really want to protect humans, the best thing to do is to vaccinate dogs. By doing that, we will stop. And we know there is plenty of scientific paper that indicate that the rabies is sort of not density dependent. So it's going to be very complicated to impact rabies by reducing the number of dogs. So vaccinate dogs and promote this responsible dog ownership would be my response to maximize our efforts.
Anyone else? Okay, so I would like to also complement this. I fully agree with my colleagues. So we really understand, and our recommendation, of course, is based on the WHO technical report series, the expert rabies consultation, that also there is a chapter talking about this issue, that we need to prioritize the dog mass vaccination campaigns. But I think that's when we are on the road to the elimination of canine rabies. So those countries that already has eliminated or have a good level of control, the neutering party could be used as a educational tool. So you can go inside of the community and use this tool to reach more information. But I think that the prioritization of activities are dog mass vaccination campaigns. So if you do have rabies, if you're an endemic country, you should put all your efforts on the dog mass vaccination campaigns. Of course, well planned, with good quality vaccine, with the estimation adequate, so you can optimize your fund. Secondly, but not alone, so as Gregorio said, so the dog population management and responsible dog ownership. So without a responsible dog ownership, the neutering or sterilization procedures that you could do in a community would not be effective, because if you don't have responsible dog ownership, unfortunately, those dogs could die in few years, because are hit by a car or not vaccinated for other disease. So all the efforts that you put for neutering dogs, the dog will die, could live 10 years, 12 years, and will die with 3 years, 2 years of age. So this could not be effective. So the neutering and sterilization programs and dog population program should be implemented after I have all of this. But of course, some conditions, some populations, some communities, those are important tools to bring education on the veterinary public health, on the prevention of other zoonotic disease, including rabies. Thank you. So I don't see if you have any question, but Gori would like to make a comment. Please go ahead.
I see Yu's comment saying there's a question. Maybe she can answer that. I don't know what the question is though.
Yes, maybe just wait for Marco to bring it under the spotlight, but on the topic that we just discussed, I fully agree with all your comments. I think if the resource limitation is serious, we should focus on the other efforts to the vaccination campaign. But if we could have additional capacity and resources, in the meantime, we should also advocate for the awareness, communication, and also training to improve the dog population management. That is also the position from FAO side. Thank you.
Thank you. Thank you. So I don't see any more questions from the Q&A. Do you see any more questions, Gori? I don't see here any more questions. Gregorio?
Marco, there is a question. I think it's to me.
Okay.
That is raised by, yes. That is raised by Angie. So the question is to ask her if I could share more information from FAO about the FAO vaccine registration system, and
yes.
whether it will be something similar to the UFMD vaccine pre-qualification system. So yes, I think this is a very relevant question. So the UFMD, starting from a few years ago, they have already established their vaccine pre-qualification system for foot and mouth disease. vaccine, which is a bit similar to the pre-qualification vaccine system established by WHO, but UFMD so far has only been working on the FMD vaccine pre-qualification system. So now we are trying to establish a new, but built on what has already been established by UFMD. So we are going to learn from the experience gained by UFMD, but also to further build on that, to also include many other important animal disease, for example, like the lambskin disease, PPR, sheep-goat pox, and also rabies. So far, we have already issued the call at the UNGM, the United Nations Global Market, for the vaccine registration on lambskin disease, sheep-goat pox, and PPR. We are going to launch a new call on foot and mouth disease very soon. And for those vaccines that have already been pre-qualified by UFMD, they will be automatically endorsed by the FAO vaccine registration system. So they will also be, in the meantime, registered by the FAO vaccine registration system. And in the future, we will cover more disease, like rabies. So the major advantage of that is by already including them in the registration system, in the future, when FAO is procuring vaccine, we can likely through the direct procurement or the long-term agreement with those registered vaccine manufacturers to directly get vaccine products from them without opening a new call and go through the very tedious and long quality, the technical review and the clearance stage. So that is the major purpose. And in the meantime, we also see many benefits. For example, like once, just taking example of the rabies vaccine, once it is registered by the FAO vaccine registration system, it will also be a stimulus for many other vaccine manufacturers to also participate in the FAO system and also receive feedback whether they comply with the international standards and requirements or not. If they haven't been fully in compliance at the current stage, FAO will also provide comments and feedback to them on the areas of improvement for them to gradually get improved in the coming years. So by doing so, we are hoping that in the future, the markets, the veterinary vaccine markets will be more occupied by the quality vaccines with demonstrated safe and effective. Yeah, thank you. I hope it clarifies. Otherwise, please leave a comment again in the chat.
No, thank you. I think that the pre-qualification it's very important. For example, the human rabies vaccine, they have this system of pre-qualification. And for example, those agencies that support the procurement of human vaccines, such as PAHO or UNICEF or even other organizations such as Gavi, to have a pre-qualified human vaccine is very important. So it give us this guarantee that this product is a high level, high quality product. For the veterinary vaccines, for example, in the revolving fund, we do have the veterinary vaccine, the rabies vaccine, the canine rabies vaccine. So as we don't have pre-qualified vaccine, we have to use all the standards, of course, from WOHA. That is very important. But also we put some additional requirements. For example, must be registered in veterinary services in the region, and also we increase the level. So all the vaccine provided by the revolving fund in Americas, so the international unit must be superior to 2, in not only 1. That is the standard. That is good, but we want better vaccine. So having this pre-qualification system would also support this regional mechanism to support countries to have better quality vaccines for providing for the countries. I don't know if you have some comments. I don't know, Warren, Gregorio, please.
Marco, I just want to add on. Thank you very much for the excellent summary. And I just want to add on that the FAO vaccine registration system was just started from 2023, although UFMD started much earlier with the foot and mouth disease vaccine. But with the generic vaccine registration system at FAO, we just started from last year, and we have already established the guideline on the vaccine, veterinary vaccine registration at FAO. But currently, this guideline is not publicly accessible. We only share it with the FAO country teams who are involved in the procurement. But in the future, once the vaccine manufacturer has already been successfully registered within the FAO system, we will share with them the guideline and also a formal letter from FAO to inform them like what would be the next options to supply vaccine to FAO under the current registration system. And but we are also not fully ready to publish all the registered vaccine manufacturers on the FAO website. We need to consult with our legal department before making such decision. I just want to add all those information just in case if some audience are interested to know. Thank you.
Thank you. Thank you. Wari, please. And then Gregorio.
Oh, no,
Whoever wants to go first.
Wari, go ahead. Go ahead.
I'm
Sorry.
learning a lot from you. I was almost the audience. No, nothing else from me. Thank you.
Marco, if I may make a comment, because we also need to be frank on what's involved procurement, national procurement, and basically the quality of the vaccine is the starting point, but there is also different steps on that. And this is something we also need to help the countries to progress. I think my colleague Rachel put some guidelines that we publish on helping countries in the procurement process of animal vaccines that will have a direct impact on that. And of course, assessing the quality of the vaccine is the starting point, but it's not the only point. And it's probably the point which I think by now we are all agreed that is probably the more critical, and that require technical assistance. And here is where I want to also be very clear. Countries, our colleagues, they can have access to our experts, the WA Reference Lab, WHO Collaborating Center, FAO Reference Lab. We do have an army of top expert, international experts that can help countries to define whether or not the vaccine that is in the market has been manufactured according to international standard. So I understand this could be a difficulty at national level, because how to test the quality of the vaccine, how to assess if what the manufacturer is putting in the information sheet is actually aligned with the international standard that we do in WA. But again, it's an invitation through United Against Rabies or WA Reference Lab, WHO Collaborating Center, FAO Reference Lab. I think our colleagues, some of them are here in this call, they are ready to provide this kind of information. So if countries need to, during the procurement process, need to assess the quality of the vaccine, so feel free again to reach to the international community. That's part of their terms of reference is precisely to assist countries on that. So I think that's this is something that is a service which is probably underused. And I wanted to be clear that this is available and it's as simple as contacting any of us and we can figure out how to do it efficiently.
Thank you very much, Gregorio, for this. I was wondering here, I don't know that it was not discussed previously, but I think that other materials that we use for the campaign. So not only the vaccine, but for example, the syringes, the needles that we use. The vaccine bank, Gregorio, does also provide these materials for the countries, or they need to procure by the local? Okay, it's a local procurement system. Okay, because this is also important in this optimization of resources that we are talking about. Of course, the vaccine, but they use, for example, we recommend the use of one needle and one syringe for the dog mass vaccination campaign, for example, in the countries in Latin America. So this is also important to consider when you are going to plan a dog mass vaccination campaign, but also the personnel, the professionals, the volunteers, the people involved during the dog mass vaccination campaign, and having all these plans. So you can see how the estimation of a dog population, it's important to start thinking in how to develop a dog mass vaccination campaign. So I don't know, Cassandra, do you have any other thoughts to share with us? I saw that there is some discussion going on here in the chat. If you want to summarize to us the discussion you're having with Ricardo, please go ahead.
Yeah, Ricardo asked about how we decide what Stark areas achieve sustained rabies transmission. And so I was just answering his question about that. But basically, we assume a density-dependent relationship with the number of dogs and if rabies transmission will be sustained. We've done a lot of surveillance in Latin America and found that dog rabies is not routinely detected when the free-roaming dog population density drops below 12 free-roaming dogs per square kilometer. And we've also found that strong relationship between dog density and R naught. And so we have a paper on this under review right now, but we use that density-dependent relationship to determine if our zones are transmission and will have sustained transmission or susceptible, and we don't expect that sustained transmission.
Thank you, Cassandra. Gregorio, I think that we don't have any questions, any additional questions.
Oh, if I may, I just
Yes,
want.
you can take your question. Go ahead.
Thank you very much for the floor. I just want to add on the earlier discussing. Especially, I want to acknowledge Gregorio for sharing the WAHA guideline for issuing the tender from the national government and also helping the country national government to assess the vaccine that are suitable to be used. So indeed, Gregorio has already mentioned it clearly. So those are the two different purposes and the target groups. So I think for the WAHA guideline, it's mainly to support the national government, the veterinary service, and the government sector. And what we were talking about, the WHO vaccine pre-qualification system, the EU FMD pre-qualification system, and the FAO vaccine qualification system. They are separately. It's mainly for the cooperative organizational use, for the organizational procurement system. So we go through the UNGM, the United Nations Global Market, and whenever we have a tender there, we provide the detailed list of all the information that are required from the supplier. And based on those information, the next decision will be made whether they are qualified or not. So those are different steps, but we can complement each other. And now we are also organizing different calls with our member countries and also vaccine manufacturers to see how we could better improve our system to make it play the biggest advantage and also serve as many stakeholders as possible. Thank you.
Thank you very much.
Marco, there is a question in the chat.
I you want to make some comment, Gregorio, please.
No, it's a question in the chat.
Let's see.
Sorry, in the question and answer. And
okay. What's your opinion on combination of vaccines, rabies and distemper? I think this is a more technical. So what do you think about the combination vaccines, rabies and distemper? I think that you say multi-viral vaccine. So I don't know. Anyone want to answer that question?
Shall I go ahead?
Please, Rory, go ahead.
So it's a good idea, but it costs more. Every disease you add to your vaccine, it's going to cost more. If you can afford rabies and distemper, go ahead. But don't compromise on the number of dogs or the coverage for rabies, though. Gregorio, you have anything?
Well, Marco, if I might, no, I agree, Worry, on that. This is a very particular situation that, in certain countries, it might be more cost effective for many different reasons, even public education. You don't want to create an outbreak of distemper because your vaccination campaign that you can lose some trust. So I totally agree with you. the optimization of the vaccination campaign need to consider all the factors, including socio and cultural factor. But that brings me to a work that has been done by Unite Against Rabies as well, which is combination of intervention. We know, and I keep insisting, the most expensive part of the vaccination campaign is to bring the vaccinator close to the dog. Petrol, car, salaries, per diem, food. So if you can combine intervention, when there is any intervention from animal or humans to the village or to the area that you need to vaccinate, and you can combine. And I think my colleagues from SADC are here, and I know in the southern part of Africa, it's relatively common to combine foot and mouth vaccination in cattle with dogs rabies vaccination. So the same people vaccinate cattle in the morning, and then they take the vaccines to vaccinate dogs in the afternoon or at the same time. And we hear also with PPR, but they also hear in human health intervention that they go to vaccinate kids with any disease or any intervention. So just educate these people and put some cool box with some vaccines, and you educate these people. They don't need to be as a qualified veterinarians to vaccinate dogs. They just need to be well educated and need to be supervised by veterinarians. So a way of maximizing and avoiding wasting resources is by, once you go to that, take the lift and share, and I'm pretty sure you will make some good friends, and you will save money, and the impact would be much greater by combining intervention. So it's a little bit, my answer, sorry, Henry, is a bit broader than just distemper, but I think it's also very timely. And there was some work done by Unite Against Rabies, really exploring how to combine this intervention. And I believe in the website, there is already some information about that. So it was a little bit opportunistic comment, Marco, but I could not resist to do it.
No, it's perfect, Gregorio. Thank you. Thank you very much. So I see one more question here in the, no, there is no more question in the box. So I think we're getting to the end of our dialogue here today. So I would like to thank everyone that was able to participate in this webinar. That's really important for those who organize, implement, and develop dog mass vaccination campaigns around the world. So thank you again for all organizations that supported, and CDC, FAO, SEVA, and of course, WOHA. And thank you very much for your participation. So hope to see you soon next time. Thank you very, very much, and have a nice day, everyone.
Thank you, Marco.
Thank you, Marco. Thank you all. Yeah.
Thank you for facilitating.
See you in the new
Thanks,
year.
everybody. Ciao.
Bye-bye.